we're going to be doing a sterile wound dressing here for Mr. Wilson. So first things first, I'm going to come in the room, do some hand hygiene, and introduce myself. Hello, Mr. Wilson. My name's Ben. I'm a nursing student. We're going to be doing a dressing change on your right forearm here.
Okay.
Perfect. So he's going to understand that we're doing this. He's going to help me out any way we can. I'm bringing the bed up to the safe working height. I'm going to do any assessment for pain beforehand to make sure that he's not in any pain, because we're going to be manipulating this arm and doing the dressing change. So I've done some hand hygiene. Mr. Wilson's aware of what we're doing. I'm going to put some clean gloves on. We're going to remove the old dressing. We're going to note any drainage, the exudate that's drained. We're going to just take a general appearance. How is it looking? Make sure that we note that. So I can take this, pop this in my garbage can here. And now that we've exposed the wound, we're going to get our supplies ready. So this is obviously a student copy, so it's plastic bag's gone. Same with the gloves, plastic bag has been removed, but we're going to leave those off to the side. We're going to prep any supplies that we need. So we've got some sterile gauze, we've got some tape, some normal saline, and some hand sanitizer. So we're going to give our hands a sanitize, and we're going to open our dressing. So take it out of the plastic bag. We're going to go away from us, making sure not to grab within that 1-inch border, because that's the sort of handling border. I can move this over here. Hand hygiene again, obviously, because I touched that. 1-inch border, 1-inch border, perfect. And then we've got this one here, and we've got our handling tongs. So we don't want to have sort of anything hanging too far off, and we want to have that nice and square on the table here. Perfect. So now what we can do, tongs down, is grab the sheet. I can pass it to myself, put it right here. Grab our garbage bag, put it right here. We can take our handling tweezers, grab these ones, set these up for us to use. Let's just put that right there. Perfect. Okay, now we can put our tweezers down here safely within that border. Let's go ahead and set this up here, not turning our back to the sterile field. Mr. Wilson, can you lift your arm up for me? Lovely. I'm just going to put this underneath, catch any drainage. Make sure we don't make a mess of this bed. We'll set up our garbage can. Perfect. So I'm going to do hand hygiene again. And we're going to add some normal saline and some supplies to our sterile field. So let's put this in first. We've got normal saline, not expired. We're going to pour with the label up at a height of about 6 inches, not splashing. That should be good right there. We can put the lid on, and we don't need this anymore, so we can put this off to the side. Next, we're going to open up our sterile gauze, opening it off of the sterile field, and the angle onto there, making sure that we're in that 1-inch border, and I can put that in the garbage. We've got our fix that we'll keep over here, and we've got some hand sanitizer. We'll just give our hands a wash, and we'll get our sterile gloves on so that we can prep everything here. So, same thing, take it out of the plastic bag, make sure we've got lots of room for us to work. Left and right, we can grab the borders here, left and right. Perfect. So we're going to put our dominant hand in first. So we'll do this one here, so I can grab the inside. I can put my hand in, and we're good to grab the inside of the cuff, just like that. Now I can take my dominant hand, slide it in here, and put my non-dominant hand in, making sure that we're touching the outside of the cuff. Perfect. Now we are sterile. We can grab this because that's sterile here. Making sure not to put our hands below the table height. We've got our table height set to here. Let's go ahead and make some rosettes. So we can put all this in here. Perfect. So to set up our rosettes, we can grab one piece of gauze, make folds all the way in here, fold, fold, and fold. Set that up here. We can take this one, make sure we've got one piece of gauze, fold these in just like that. Another rosette, and we'll do another one just to be on the safe side. Make sure that we have the right amount. Perfect. Okay, so tweezers down, we're going to clean the area with our rosettes. So one swipe down and into the garbage. Take our next rosette on the other side, one swipe down into the garbage. Take our next rosette, one swipe down into the garbage. Perfect. Now we've got our drying gauze here. So again, we're going to make a rosette, just like so. And same thing here. One swipe down in the middle, garbage, in, and in. So now we can swipe on the one side straight down, and we can see that it's nice and dry. So we're going to take a look at our wound over here. We're going to see if how well approximated it is. We're going to count the sutures that we can see. We're going to see for any signs or symptoms of infection, inflammation, as well as length of the wound. If there's sort of anything that doesn't look right and how that wound should be properly healing, we'll take note of that. So now we're going to put our dressing on, just like that. Actually, let's go ahead and fold that just like that. We got one side here. Next, we can put these down, and we've got the wound covered, so now we can apply some tape. So we'll open the tape up. Just like this. And over like this. There we go. Okay, Mr. Wilson, we'll how did that go for you? We'll assess how that went, and we will finish the video there.